On this edition for Sunday, March 8th, the latest on the coronavirus outbreak. After years of planning, the 2020 census makes its debut this week. And in our signature segment, a new approach in Louisiana to prison reform. Next on PBS NewsHour Weekend.
PBS NewsHour Weekend is made possible by Bernard and Irene Schwartz, Sue and Edgar Wackenheim III, the Cheryl and Philip Milstein family, Rosalind P. Walter, Barbara Hope Zuckerberg, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments. Additional support has been provided by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you. From the Tisch WNET studios at Lincoln Center in New York, Hari Srinivasan.
Good evening and thanks for joining us. The new coronavirus has now spread to 107 countries, and there are close to 108,000 cases around the world, according to the Johns Hopkins University Coronavirus Resource Center. Italy is one of the hot spots, where more than 360 people have died from the virus, and the government issued a quarantine restricting travel for more than 16 million people in the northern part of the country. It affects cities like Milan, Venice, and more than a dozen provinces until April 3rd. In the U.S., the Grand Princess cruise ship is expected to dock tomorrow at the Port of Oakland. 21 people on board have tested positive for COVID-19. Princess Cruises said those in need of acute medical care will be evacuated to local healthcare facilities for treatment, while the other passengers will be tested and isolated at additional facilities. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases at the NIH, had a message for those vulnerable to serious complications, particularly elderly people with underlying health conditions.
Right now, not wait until things get worse. Say no large crowds, no long trips, and above all, don't get on a cruise ship.
Meanwhile, Secretary of Housing and Urban Development Dr. Ben Carson did not state any concrete plans from the federal government on what to do with the people on board.
The ship's docking tomorrow. The plan will be in place by that time, but I don't want to preview the plan right now.
For more now on the situation in Italy, NewsHour Weekend special correspondent Christopher Livesay joins us now via Skype from Rome. Christopher, you were just traveling here before these quarantines went into place. What's it like out there?
Well, Italians are extremely nervous. You had this announcement that came through unofficial channels. There was a government decree that wanted to limit travel. However, that was leaked to the Italian press before it was supposed to be made public, and it sparked a lot of panic. You had a lot of Italians in Milan. That's the industrial hub of the economy here. A lot of people work there, but are actually originally from the South. So some of them were storming train stations last night, thinking that this was the last train out of town. Meanwhile, this travel ban, this quarantine, stretches all the way to places like Venice, and that's a city that's been reeling from high flooding that really tanked its tourism economy. And now with this latest quarantine on travel, it's just tanking the tourist economy. They fear that they're going to lose more than $1 billion. So people are extremely nervous, Hari.
What about just for their health? I mean, are people heeding the warnings? Are they keeping kind of a social distance? Are they washing their hands? Do you see people aware of this?
You know, I saw Italians taking this in stride when the outbreak first began, or at least when it was first spotted on February 21st. There was a lot of skepticism. Italians tend to be rather cynical, so they didn't necessarily trust the government when it was making these warnings. That's changing now, especially because in Lombardy, the region around Milan, you had 113 people die in the last 24 hours alone. And so with this spike, people seem to be catching on and realizing that this is not something to just joke around with. And that's a really hard adjustment for Italians when you consider how affectionate Italians are. So to not be affectionate when greeting people, it just goes against everything that makes somebody Italian. But there's going to have to be some major lifestyle change. You have the president, you have the health minister, local authorities are constantly telling Italians we have to be very careful, maintain 1 meter distance, that's a little more than a yard between each other at all times.
This is a weekend when this quarantine went into effect. How are they planning to implement it? Let's say Monday morning, people wake up. Do they get to their jobs? Does trade slow down?
The government had already anticipated that Italy alone was going to lose more than $8 billion. But that was before this massive quarantine went into place. And so it's really too soon to predict what kind of impact this is going to have on the economy.
All right, Chris Lifsay joining us tonight via Skype from Italy. Thanks so much.
Thanks, Hari.
Federal, state, and local governments are in the midst of a complicated public health crisis as the coronavirus outbreak continues to grow in the U.S. and around the world. Joining me now is Carolyn Chen, a reporter for ProPublica, who is covering the COVID-19 response and what we need to know about the spread of the virus. You lived through SARS when you were a kid in Hong Kong. You have covered Zika and Ebola. So you've got a little bit of experience watching these things roll out. What is most concerning to you right now?
What's most concerning to me is how prepared the U.S. is. And we're in a critical junction right now because speed matters right now. We're still in early days in the U.S., but how prepared we are now and how we respond right now over these weeks are going to matter a lot. And the populations I'm most concerned about are the vulnerable, and for me that means the elderly in particular with this disease, and also the frontline workers, so that's healthcare workers and first responders, because this is more deadly than the flu.
Sure.
And in particular, there's enough data right now to know that it is a really dangerous disease, particularly for the elderly. That's important to know. I think scientists are also confident enough to say that it is less deadly than a disease like SARS, where the fatality rate ended up being in the ballpark of 9 to 10%.
Let's take a look at each of those populations. The elderly, that was a devastating number of people that were affected in Seattle at that nursing care home. What should kind of anybody who has a relative in a nursing home be thinking right now? What kind of plan should those places have?
Nursing facilities, I hope that all of them really have a preparedness plan right now and are really stepping up their infection control in particular. And that is also the case for hospitals or any type of healthcare facility that are in states or in cities or in counties that have geriatric populations. But also, even if you're not living in a nursing home, if someone is elderly, they might start thinking, at some point in time, I might not want to be going out, taking public transit, and start stocking up a little bit. And I'm not talking about like panic buying, buying 16 bottles of Lysol, but start slowly and methodically, buying a little bit more groceries every time you go for a grocery run. And also I would encourage people to start thinking about their neighbors. So if you have an elderly neighbor, if you have an elderly grandparent, this is the time where we can really be helping our neighbors.
We've already seen different cases around the country pop up where nurses who are getting sick or doctors who are getting sick are saying, hey, I still don't get these tests. I just want to know if I can help people or if I would actually be a greater harm to people if I go out and touch them.
Yeah, so I think there are two elements here. One is that testing capacity really needs to ramp up in the U.S. because if we don't know where the cases are and how many cases there are, that's going to put healthcare workers at risk. The second issue is supplies and supplies of what's called PPE, which is personal protective equipment. So that's masks, gowns, and gloves. And we are already hearing that hospitals are being prepared for there to be scarcity there. And that's something that governments, both on local levels and at the federal level, are going to have to really be prepared for.
So I kind of hear you saying two things here. On the one hand, speed up and be urgent if you're government.
Yeah.
On the other hand, don't panic if you're a citizen.
Yes. So, and I think that, a lot of people I've heard saying, should I go to a concert? And I totally understand that you want to have the answer, but there isn't a blanket answer. It really depends on who you are, how old you are, what does your personal medical history look like, where you are in the country. And so you have to make that judgment call for yourself and listen to those public health officials.
All right, Caroline Chen from ProPublica, thanks so much for joining us.
Thank you so much.
Democratic presidential candidates Joe Biden and Bernie Sanders both received high-profile endorsements on Sunday. Read more at pbs.org/newshour. This week begins the 2020 census, an aim to count everyone living in the country and the U.S. territories. The findings will determine how federal dollars are distributed. Hansi Lo Wang, a national correspondent for NPR, has been reporting on the 2020 census. We sat down recently to discuss what to expect, including what's new this time around.
It's a basic set of questions that's going to ask you where you live, confirming your address, all the people living in your home, their age, birth date, phone number that someone could be reached at, race, ethnicity, and the relationship that between people living in the same home, as well as whether the home's rented or owned. Some of the changes are in the race question. If you mark off the white and or the black box to answer the race question, for the first time, the Census Bureau is going to ask within the context of race what your origins are, and those are non-Hispanic origins. They provide examples such as English or French or Jamaican or Nigerian, for example, asking them to write those in. And under the relationship question, describing how people within the same household are related, there's going to be new categories that specify same sex and what the Bureau is calling opposite sex, spouse, wife, husband, partner. That's the first time the Census Bureau is asking for people to identify their sexual orientation directly in the context of this relationship question.
Okay, so there is not a citizenship question in this census. Is there another way? Are there other ways that the government is going to come up with some sort of an estimate on that data?
The government's going to try. President Trump issued an executive order once he announced that the administration was no longer pushing for this citizenship question that federal courts have now permanently blocked from being added to the 2020 census forms. And so the Census Bureau has been working to try to compile existing government records from various federal agencies, including the State Department, Department of Homeland Security, as well as some state DMV offices, and trying to come up with a data set that would represent the citizenship status of every person living in the country.
This is happening, about 500,000 temps are required to do all that door knocking. And this is happening in the context of a coronavirus scare, which is going through the country. Any possibilities that that could impact how the results come out?
Something I'm watching right now, and 500,000 workers is what the Bureau is expecting to need if the response rate, actually self-response rate, is even lower than 60%, about 55%, and that's of households they're expecting to self-respond. And so it's a big question if the Census Bureau, right now, it's supposed to be ramping up hiring. It's recruited more than 2 million applicants, and now starting to offer positions to these applicants to see if anyone will take them and go through training over the next few months and to be deployed in May. We'll see how that turns out.
And really kind of the bottom line of this is that this is very consequential for how communities get money from the federal government and how we really think about lots of other things that have big consequences going forward the next 10 years.
You know, one way to think about the census, it's a way for every person living in the United States of America to express power. The Constitution, Article 1, Section 2, is calling for an actual enumeration, actual counting of every person living in the country. And those numbers determine how many congressional seats and electoral college votes each state gets, and it guides more than $1.5 trillion a year for Medicare, Medicaid, roads, and schools. And it's all dependent upon how many people are living in the country.
All right, Hansi Lo Wang, thanks so much.
You're welcome.
For decades, Louisiana incarcerated the most people per capita. But in recent years, a major bipartisan overhaul of the state's criminal justice system has led to a smaller prison population and a new focus on rehabilitation. NewsHour Weekend special correspondent Joanne Elgar-Jennings has our story, reported in conjunction with Bryn Stoll of the New Orleans Advocate and PBS's Independent Lens.
Every Tuesday, a busload of newly sentenced inmates from New Orleans and neighboring Jefferson Parish arrives at this state prison. This is their entry point into the sprawling Louisiana prison system.
Craig LeBlanc.
They're here in Cottonport, about 90 miles northwest of Baton Rouge, only briefly, for screening and orientation.
We're going to have our nurse practitioner come over here and look at you. All right? You take any medicines? You're not on any kind of medicine.
And you said 10th grade was the highest grade you went to. Did you take any special education classes?
Many of those arriving lack education or come in with long histories of addiction.
If you're a drug addict, you're not going to keep your job. You're going to lose your job. Okay? So once you lose your job, there's really only two ways to get drugs. That steal for it or sell it to make the drug free. Doesn't mean I'm a big drug dealer that's riding around in a fancy car and doing money in my pocket, because I didn't. I was homeless. I had no car. I had nothing.
44-year-old Craig LeBlanc is serving a 10-year sentence for possession of meth with intent to distribute. He's hoping to be placed in a state facility that offers drug rehab and educational programs. But odds are high that he'll do his time in a local jail not equipped for that.
A sentence that you spend in a local jail or prison is a sentence that probably comes with very little programming. It comes with very little opportunity to take courses on anger management or to get your GED. It means that the odds are high that you will not get routine medical care.
Jamila Johnson is a managing attorney at the Promise of Justice Initiative. It's a nonprofit that advocates for criminal justice reforms.
The odds are high that you won't get appropriate dental care. If you have a mental illness, the odds are very high that there will be no one there who will talk to you about your mental illness, treat your mental illness, or provide whatever you were being provided on the outside.
Today, more than half the people convicted of crimes in Louisiana are held in parish prisons. The state pays local sheriffs $25 a day for each person they incarcerate.
That means that the sheriffs are incentivized to A, house as many people as they can to increase the revenue, and B, provide the minimum level of services that they need to increase the profit.
Katie Schwartzman is legal director at the ACLU of Louisiana.
So it means that because the sheriffs kind of benefit from the Department of Corrections payment, the conditions in those parish jails have traditionally been really terrible.
Jimmy LeBlanc, a former warden, is Louisiana's Secretary of Corrections. He says $25 a day is simply not enough to provide anything beyond the bare minimum.
At $25 a day, you basically can, I call it lock and feed. Lock and feed is basically they have the funding to be able to clothe them, be able to provide food for them, be able to house them, and provide security. When somebody comes into our system, they're in a grade level of somewhere around the 7th grade. That's the average grade level when we get them. So obviously, they have failed in our education system. So then we get him, and we expect it to create miracles, and we're certainly not going to do it at $25 a day.
In 2017, Governor John Bel Edwards, a Democrat, worked with the Republican-controlled legislature to pass a major criminal justice reform package. Through targeted releases, greater access to parole and probation, and investment in alternatives to incarceration, the prison population has dropped about 13%, from nearly 36,000 inmates in 2017 to fewer than 32,000 today. In the process, the state has saved about $35 million. Corrections Secretary LeBlanc is now investing a portion of the savings in programs designed to keep people from returning to prison.
We can't expect people to come to prison and be dropped back off on the corners and expect them to succeed. It's not going to happen, and we're changing that, and that is a big part of our reform efforts.
And one of those reform efforts is here. At the southernmost tip of Louisiana, in Plaquemines Parish, the Department of Corrections is piloting a new reentry program. The Plaquemines Parish Detention Center is an 800-bed jail. It was built with funds from the Federal Emergency Management Agency, or FEMA, after Hurricane Katrina destroyed the old lockup. For years, it stood vacant. Now, prisoners who normally would be scattered across dozens of jails in rural stretches of the state are being brought together here. It's closer to the communities in and around New Orleans, where most will eventually be released. On top of the $25 per day that the Department of Corrections pays the sheriff for each prisoner here, it's providing an additional $1.2 million for rehabilitative programming. That includes courses on anger management and substance abuse.
So we were discussing last week about the different effects, the biological aspects.
Captain Byron Williams heads up the reentry program for the Sheriff's Department.
education is key. So the first thing is to get these guys educated. If they do not have a high school diploma or a GED, we make sure that we get them into those classes first.
There's also vocational training designed to teach in-demand trades and eventually match former prisoners with jobs on the outside.
The first thing you do is unplug your tube. Never work with a plugged-in power tube. Anybody know what this is? Nobody? No? Jigsaw.
Jigsaw, yeah.
This is a jigsaw. We're just really trying to help guys move forward, really change their thought process on how to get work and get money without being illegal with it. Pull up.
When we met Nosayaba Okanseri, he had served 5 years of a 12-year sentence for bank fraud and identity theft. He bounced between 6 different local jails before ending up here in Plaquemines Parish.
This is the best I've been thus far. As far as like programming, help, one-on-one with the case managers.
Okanseri, who has since been released, told us he was grateful he learned skills he would likely use on the outside. Word is now out among inmates throughout the state. Many are asking to be transferred to Plaquemines Correctional Center, where they think they may have a better shot at the future.
It's a renowned, good reentry program to participate in, not only for the exemplary good programs that are here that actually help you, but also for the good time, because at the end of the day, we all want that good time to go home as soon as possible.
What religion are you? I'm Christian.
Michael Sosa Santiesteban is about 2 years into a 12-year prison sentence for burglary. So far, he's served time in 11 different parish jails.
If you're lucky, you go to a parish jail which is calm, where there's zero tolerance, where there's zero violating, there's zero violence. But if you're unlucky, you go to a place where you get no rest, you get no sleep, and your expected level of security is non-existent. There are not officers like these that are on top of the ball. Like, since we've come in here, these officers are aware of everything, of every place, of every move that is being made by us here.
These people that come to prison are coming back. That's what the public needs to understand. And if they want them to come back where they can be on their feet and earn a living and pay taxes and support their family, then they need to understand that we need to invest in this system.
That's all for this edition of PBS NewsHour Weekend. I'm Hari Srinivasan. Thanks for watching. Have a good night.
PBS NewsHour Weekend is made possible by Bernard and Irene Schwartz, Sue and Edgar Wachenheim III, the Cheryl and Philip Milstein family, Rosalind P. Walter, Barbara Hope Zuckerberg, Charles Rosenblum. We try to live in the moment to not miss what's right in front of us. At Mutual of America, we believe taking care of tomorrow can help you make the most of today. Mutual of America Financial Group, retirement services and investments.
Consumer Cellular offers no-contract wireless plans that are designed to help you do more of the things you enjoy. Whether you're a talker, texter, browser, photographer, or a bit of everything, our U.S.-based customer service team is here to find a plan that fits you. To learn more, go to consumercellular.tv.
Additional support has been provided by the Corporation for Public Broadcasting, a private corporation funded by the American people, and by contributions to your PBS station from viewers like you. Thank you.
You're watching PBS.